And okay. Hi, my name is Amrika, and I am the outreach coordinator of Medical Wonders. And this is the second day of Medicine Week. And we have Dr. Virk here with us. And I'll just present a little bit of information about this program first, and then she can take over after what I have said and given all the rules. Okay, so first of all, here's some quick reminders. So to get your hours and submitted and your certificate, you have to attend 2 or more calls. And even for that to verify, you have to submit a 5 to 6 sentence paragraph about the calls and what you've learned from each of the doctors. So we have a different doctor every day, and we have 2 more after this. So we have a Google Classroom where you can submit your documents and your paragraphs. So the paragraphs should be in detail. And you have to have your full name in the doc and any other. So the highlighted green part, the points below that, is some things that you can add on your resume about the call. So, and if you have any other questions, you can email us over here. So what is Medical Wonders? It's a student-led nonprofit organization to educate and advertise students about astounding medical procedures, careers, discoveries, and devices. We are a pretty big organization with 4 executive teams, researchers, editors, communicators, and graphic designers. And we have tutors, so 50 tutors and 10 college overseers. So, and then we also have 200 plus and even 300 more people that are involved in this organization. So, and we also have collaborated with other nonprofit organizations to conduct our programs and everything. So this Medicine Week, what is it? It's every day this week, a medical professional or a medical student will go on a Zoom call with us for an hour presentation, introductions, or studies. And at the end, we'll have a Q&A session about any questions that you may have for them. So panel board, check out our Instagram for full descriptions on each doctor. They also have individuals' Instagram that you can also follow. And here is our YouTube channel. So we'll post all the recordings of this program or this week in our YouTube channel, and you can check it out. If you've missed something that you want to go back and listen to for your assignments, then you can also do that. So I think that is the end. Okay, Dr. Virk, you can take it over now.
Sounds good. I'll go ahead and share my screen. Is it okay if I stop sharing your screen, Samrika?
Oh yeah, definitely.
Okay. Mm-hmm. Sounds good. Okay, and I'll go ahead and start presenting. So good evening, good morning, good afternoon, everyone, wherever you are. My name is Mehr Virk. I am a pharmacist, and today I will be sharing with you all my journey through pharmacy. And just to give you a little bit of oversight on what I'll be covering today, I'll be going over why I decided on pursuing a career in pharmacy, the schooling and extracurriculars I participated in to get to where I am today, social media, since it's an aspect of kind of what I do and a hobby of mine, as well as where I'm at today with residency and where I see myself moving forward outside of residency. And just to give a little bit of context, so my official licensure is a PharmD, which stands for Doctor of Pharmacy. This is considered postgraduate training. I'm currently located in the United States, and so in the state of California. And so I pursued an undergrad. I then went to pharmacy school, and after doing so, I earned my Doctor of Pharmacy degree. To give you a little bit of background about myself, I'm originally from Sacramento, California. I went to undergrad where I earned my bachelor's at the University of California, Berkeley. I then went to pharmacy school at the University of California, San Francisco. And then I completed my first year of residency in an acute care program at the University of California, Davis. And I'm currently in my second year of residency as an emergency medicine pharmacy resident I stayed on at the University of California, Davis. So why pharmacy? I feel like this is not only a question I got the most during my pharmacy school interviews, but it's something I get asked quite often because pharmacy isn't something that many people talk a lot about, I feel like, as what they want to be when they grow up, which is a pharmacist. But for me, really, when it came down to figuring out what I wanted to do after high school, I knew that I really liked working with people and that I really enjoyed the sciences. And so I thought the health field was a great place to be able to merge those two interests. And I looked into becoming a doctor, an optometrist, a dentist, a nurse, and lastly, becoming a pharmacist. And so I cold emailed a pharmacist at UC Davis. Actually, I'm from that particular area, and I was able to shadow an outpatient transplant pharmacist, so somebody out in a clinic. And there they met with their patients independently. So when a patient made their appointment, it was to meet with just the pharmacist. The pharmacist was well-versed in all aspects of the medication. So the dosing, the indication, the pharmacokinetics, the pharmacodynamics. So not only how the drug works on the body, but how the body works on the drug. And last but not least, I really enjoyed the interprofessional aspects. So how heavily relied on the pharmacists were and how closely they worked with other providers and how readily their recommendations were taken. And so once I decided I wanted to pursue a degree in pharmacy, so to get my PharmD, I ended up needing to go to undergrad first. And so this is where I ended up going to UC Berkeley, which was 4 years of my life. I earned my Bachelor's of Arts in Integrative Biology. It was a great 4 years. I enjoyed every minute of it. It was definitely challenging, but I think the opportunities I had there really set me up for pharmacy school and just being able to get the classes that I needed to be able to apply for pharmacy school. To give you a little bit of an idea of what I did in order to prepare for pharmacy and whatnot, and really make sure that this is something that I knew that I wanted to do. We did have a pre-pharmacy club on campus called PILS, so the Pre-Pharmacy Informational Learning and Leadership Society. And so all 4 years of undergrad, I was a participant. So I was a member my first year, a committee member my second year, the vice president of external affairs my third year, and a president my senior year. I also worked as a pharmacy technician. So in the United States, anybody can become a pharmacy technician as long as they've graduated from high school or have their equivalent degree, and as well as being over the age of 18. So as soon as I finished high school, I got my pharmacy technician license. And throughout undergrad, I worked at an independent compounding pharmacy. I also worked at CVS, which is a retail pharmacy here as well. I volunteered at the health services pharmacy on campus. And then I was also the pre-health decal teacher and administrator. So at Berkeley, you were able to teach interest classes. And so I coordinated the pre-health decal, which included 2 different facilitators for each of the 5 health disciplines. So nursing, pharmacy, medicine, dentistry, and optometry. And last but not least, I was a SAGE mentor. So I volunteered at local elementary schools in our area because I was really interested in working with that population further down the line, patient population wise, and then especially being able to just do outreach and kind of mix up some pharmacy extracurriculars. It's great to do pharmacy things, but it's also great to do non-pharmacy things. And so after undergrad, I submitted my applications for pharmacy school. So just to give you an idea, at the end of my 3rd year of undergrad and right before my 4th year is actually when I took what's called the PCAT, the Pharmacy College Admission Test. It's not required by every single school. I actually only applied to one school that needed it, which is the school I ended up going to. But PharmCast is the application service which you use in order to apply. And so I applied to 4 different pharmacy schools, all in the state of California, since I was interested in staying in the area at the time. But again, a centralized application service that you can use to apply to any pharmacy school in the country. They all have different deadlines for when their applications are due. And then from there, they reach out to you about whether or not they're offering you an interview. And then over the next couple of months, you undergo the interview process and eventually you get offers. And by the end of my senior year, I knew where I was going for pharmacy school. So I ended up going to UCSF, which on a map is literally right across the Bay Bridge from where I went to undergrad at UC Berkeley. And I did pharmacy school in 3 years. UCSF used to be a 4-year program, and most pharmacy schools in the country are, but UCSF was transitioning over to a 3-year program, and I was a part of that first cohort. I lived in San Francisco for the first 2 years doing my didactic experience, as well as some experiential training. And then I did my 3rd and final year off-site in Sacramento area, actually. But again, just to give you some idea of what the different extracurriculars I participated in order to, again, really solidify for myself that this is what I wanted to do, although I was already in pharmacy school, so definitely down this path already. But personally, things that I sought out while I was in pharmacy school were an internship with the Kaiser National Specialty Pharmacy. They do a lot of work with specialty disease states, REMS programs, and different oncologic disease states. I was the School of Pharmacy Vice President of Internal Affairs. I was the general practice, so the entire UCSF campus pharmacy representative, since we had colleges of medicine and nursing as well. And I believe there were a couple of others. I did community health outreach, so whenever the opportunity presented itself to be able to go out into the community and help with hypertension education, cholesterol, teaching about asthma and whatnot. The area we live in is quite close to an area that gets fires quite often. And so being able to offer some sort of education around that was really a great experience. And then I was also a reading partner. So again, I enjoy going out into the community, like working with younger populations and helping them learn and do something different. And again, love pharmacy, highly recommend getting experience there, but being able to do something else, I think was really important for my own sake. And then in regard to the program that I was in, so my pharmacy program, my first year and the way that our curriculum worked is that 1 day a week for 8 hours, we would work in a retail space. So I worked at a Safeway, which is a grocery store pharmacy. Then over the course of the quote unquote summer we got, because we really didn't get much of a summer considering that we were a condensed curriculum. So out of the 7 weeks I had between the end of my first year and start of my second year, I did 2 weeks as an internal medicine pharmacy student at UC Davis. And then over the course of my second year of pharmacy school, I did an introductory pharmacy experience at school, so in the cardiology unit. And then my 3rd and final year of pharmacy school was purely experiential. There was no class. I actually didn't even live in San Francisco. I moved back to the Sacramento area, and I did all of my rotations at either UC Davis or at Sutter Roseville. Throughout the end of my 3rd year, so I'd say about December, which is coming up, same time frame to March, there is something called the match. And so after you finish pharmacy school, you are considered a pharmacist, a doctor of pharmacy. The only thing that's coming between you and being able to practice at this point is your licensure, which I'll talk about. But in the event that you want to pursue some postgraduate training and you want to specialize and really better understand the area of pharmacy that you're going into, or maybe it's a more specialized area and you'd like to get to that point and be in that job sooner rather than later, the match offers you the opportunity to enter a residency. And it, as it says on the slide, pairs applicants with available residency positions via the online portal, which is called Forecast. So PharmCast for undergrad to pharmacy school, Forecast for pharmacy school to residency. And that whole process is also pretty time intensive. So there is a huge period which starts basically about next month until December, where you have the opportunity to go to different programs, open houses, to all of these different fairs and whatnot, to speak to residency program directors, current residents, to figure out what type of residency you're interested in, at what institution. You then apply through Forecast. You find out over the months of January and February where you were offered interviews. You complete those interviews, which often are quite long days and include not only a panel or one-on-ones, but also presentations. And then in March, there is one day where all of the pharmacy students who participated in the match find out whether they matched or not and where. And the only reason I bring this up is because around this time, my third year of pharmacy school was right when COVID hit. And so I had realized that I had a lot more time now since 2 of my rotations had gotten dropped. But I share a lot of my experience through that whole year, my residency experience, and even my first year of residency on my podcast, if you're ever looking for an opportunity to listen to it there. As was mentioned previously, I do have an Instagram as well that captures a lot of what I do on a day-to-day. And then I also keep a really great, what I think is a really great recollection of all of the different steps I took for residency on my YouTube channel, because it can, like I mentioned, be quite time intensive. And there's a lot of small details, and I share a lot of the presentations that I made there, a lot of the resources I created for myself, ways that I stayed organized, and so on and so forth. And so, like I mentioned, at the end of pharmacy school, you've graduated and whatnot, you've earned your degree, but you're not necessarily licensed. And so you can't practice just yet. And so licensing is required in order to practice as a pharmacist. And so the first part is to complete the application. So every state has their own board of pharmacy, and they have their own set of paperwork that needs to be completed and that you must submit to them. Once the board of pharmacy has, whatever state you're in, whatever board of pharmacy gets your application, you then are able to schedule your NAPLEX and your CPJE. The NAPLEX is a nationally administered pharmacy clinical exam. So no matter where you are in the United States, the NAPLEX is the same exam. I believe it varies by the date on which you take the exam. It's offered multiple times throughout the month. There are usually many testing centers for it, and so on and so forth. And then the final exam is the CPJE. And so this is more so just falling under the umbrella of the law exam. I live in the state of California, and so this is called it's a California specific law exam. The other states have the MPJE, which is also a state specific law exam. But what's unique about California is that our law exam also includes clinical questions. So it tends to be a little bit of a steeper learning curve and whatnot, but it is technically under the umbrella of a law exam. And so once I finished pharmacy school, I participated in the match. I passed my board exams. I started my residency program about a year ago in June of 2021. I did a postgraduate year 1, so PGY 1 in acute care. So I was in the hospital. I'm very interested in like high acuity care and whatnot. So I knew that I wanted it to be inpatient versus outpatient in the clinics. Unlike medical residency and whatnot, you don't apply for the specialty you're interested in right away. The first year tends to be a little bit more broad and all-encompassing. And once I finished that first year at UC Davis, not even throughout the entirety of the year, but about halfway, a little bit less than halfway through my first year, I knew that I wanted to specialize in emergency medicine. So I early committed to stay on again this year. And so this year I am a postgrad year 2 in emergency medicine. It is also a 1-year program. I'm still at UC Davis. And so now 6 of my rotations are in the ED, and the 6 other of my rotations are in the ICU and other elective spaces. So I'm definitely excited to be staying and to be able to specialize in what I'm really interested in. And for me, at the end of the day, my big goals and kind of what I'm working towards in pursuing all of this education and going down this path of pharmacy is that you can actually get board certification here. And a board certification in emergency medicine actually just got released for this current cycle. So those who will be sitting for the exam, this will be the first time it's offered. And being at a tertiary care center like UC Davis, the current hospital I'm at, they offer a multitude of different services, a lot of different specialties. You see a lot of the really crazy, unique, cool cases, and they get flown into us or brought to us directly. And having a level 1 trauma center, not only do we take care of pediatric patient population, we have, of course, our adult patient populations, but we receive a lot of transfers from nearby hospitals. So you have the opportunity to do a lot of great work and really see a wide range of patients from all over the state and from other states and so on and so forth. And so being able to continue to practice in the setting is something I'm definitely looking forward to as I progress. And that's a high-level overview of kind of who I am, where I'm from, what I do, and whatnot. So if you have any questions, please please feel free to ask them. There are no stupid questions, no bad questions. I'm a pretty open book. So if you have anything you want to ask me, please do so. And then if there's anything you don't want to ask, you can always email me as well.
All right, so does anyone have any questions for Dr. Virk about pharmacy, or any even high school or college questions?
I have a question.
All right.
Well, so what would be some advice you would give to current pharmacy students, and how to study and not be overwhelmed?
Yeah, that's a great question. It's something I definitely struggled with when I started pharmacy school myself. I feel like the first block of classes, I tried this whole new technique of studying with others because I thought it would go a lot better. But what I found that worked best for myself is that I would download the lecture slides to OneNote so that I could take notes during class onto the lecture slides directly. For me also, our classes were recorded. And so I would not only go to class and try to take in as much information on first pass, but then I would also review at the end of the day, watching it at double speed as a review for myself. I think repetition is really important, but sometimes you lose all of that takes a lot of time as well. So I think it really is about, when you are studying, really focusing on the studying and trying to pull the main points away from it rather than some of the more minute details. And finding a system that works for you and that works well, I think is also important. It may take a couple of tries, but eventually you'll start to figure out what are the key pieces of information, how are they being shared and expressed to me, and going from there. But at the end of the day, that's not to discredit the fact that pharmacy school is a lot of work and it is a lot of information. But as long as you don't give up and continue to apply what you know and kind of start to think in that mindset of, what does this drug do? Where is it acting? How do I know the body works? What's wrong? And how is this going to fix it? It'll start to all tie together a little bit easier, hopefully.
Okay, thank you.
Yeah.
All right, so Sophia in the chat asked, what did you do in high school and what is your favorite part of pharmacy? Those are two separate questions. So
yeah, definitely. I can start with the first question. So for myself in high school, if I think back, things that I participated in, none of it was pharmacy related. None of it was career related. I played basketball. I played volleyball. I was in the 3 different bands. I was a Girl Scout. What else did I do? I was in the National Honor Society, things like that. I did a good number of extracurriculars, and I was fortunate enough to get to do them with my friends and whatnot and really enjoy that time. And it really truly wasn't until I got to my senior year of high school that I started giving it serious thought as far as what I want to do. So my biggest advice is definitely to be well-rounded, find activities you're interested in and to do them, because some of those things I did in high school are things that I wish I had the time to do now and that I really enjoyed. And so, yeah, no, it was just kind of what I did was really nothing career related. It wasn't until I left high school that really everything became pharmacy focused. And then the second part of that question was my favorite part of pharmacy. So my favorite part about pharmacy is the fact that I am the drug expert. And that might sound a little bit conceited, but what I mean by that is I think it's really great to have this just plethora of knowledge that you can utilize to help people become better again. And for me, it's really that opportunity. Being a pharmacist, I have the chance to work with a bunch of different patients, to review all of their cases, to really get involved with their care and be that conduit for providers between the patient-specific factors and what we know about medications. And so there's a lot of things that we know to be true about medications, but what really changes our therapy and our courses of action is taking our patient-specific factors and applying that to what we know about the medications. And so having that knowledge base, being able to know how to think critically like that, to apply that in real life scenarios, and especially in the field that I'm interested in, emergency medicine, doing that in a high-paced, high acuity, high stress environment for me is really rewarding. And so at the end of the day, I really like having that communication, that interprofessional work, and the ability to really go into my job every day and feel like I'm not only helping other people, but I'm challenging myself and I'm really able to give back and do what I was trained to do.
all right, thank you. And Kavya, first of all, thank you for your presentation. And she said, I'm a 3rd year of undergrad at college, and I feel kind of behind with shadowing and medical experience due to COVID starting right when I graduate high school. What do you suggest for a third-year student in that position to focus on?
Yeah, well, I think being at a seminar like this is definitely a really great first step. So that's awesome. Other things to consider is that depending on where you are and how things are opening up, give cold emailing a shot. Email people in positions that you're interested in at a local hospital, wherever that may be, in whatever position you're interested in, see if they'd be able to give you that opportunity to shadow. I don't think there's really anything else that can substitute for that. And in the event that they can't, maybe set up a quick Zoom call with them and make sure that you use that time wisely. Have a set of questions that you're really interested in getting to know about, perhaps what a day in their life looks like, what are some challenges they face, what's the most rewarding aspect, so on and so forth. But really just being able to talk to other people. And you never know. I think one of the biggest lessons I've learned throughout my professional career is the power and the impact of networking. Sometimes it takes a conversation with one person to lead you to somebody else, to lead you to something else. And eventually you figured out this whole new world and this whole new web of what you could have the possibility of doing. So I recommend cold emailing, attending shadowing events, being able to speak to others, and so on and so forth, and see if there's any opportunities to do any clinical outreach or community outreach, any health fairs and things like that. If you can, maybe go to local high schools or elementary schools and do maybe some sort of teaching or education, anything like that. But definitely thinking beforehand, maybe some ideas and areas you can go to and try to implement them would be a good idea. But otherwise, yeah, I definitely applaud you all. You are in a very unique position of having to have been in the pandemic for probably really crucial times of whatever professional path you're pursuing. And so I think there will be a lot of consideration for that. But I think if you show that you took initiative, try to seek out other opportunities, it'll work in your favor.
Okay, thank you for that too. And Dia asked, how do you deal with more difficult patients or patients who are unwilling to listen to you or other pharmacists?
Yeah, I think that's a great question. So part of the work that I do being in a hospital is that a lot of my patients are actually pretty sick. And so we don't really speak face to face. But on the outpatient side in the clinics, I think something that's really unique is that you have the opportunity to give education and you are that person that's there for these patients who set up appointments with you and whatnot. But at the end of the day, I think the thing that helps me the most is the fact that I'm there to do my job, and that the education and the knowledge that I have, I am able to disseminate it and be able to explain it to people. But what people decide to do or what they don't do is completely out of my hands and it's out of my control. So you can offer the education, you can put things into as layman terms as possible, but at the end of the day, people make decisions for themselves. And I think part of the challenge of being a pharmacist is being able to navigate those as far as creating a regimen, making clinical decisions that take those into consideration. You can't make anyone do anything, but you can offer them the knowledge, the education, the resources, and the support to set them up for success. So it can be frustrating. It can be really difficult, but you remind yourself at the end of the day, you did this to help people, and whether or not people accept that help is completely out of your control. It's nice when they do, don't get me wrong. It's definitely like a winning feeling. But at the end of the day, as long as I can help one person or make a difference to one person, then at least something I'm doing is bringing good into the world. So you don't win them all, but you can have a pretty good shot once you get a little bit of experience.
That's kind of inspiring. I actually really like how you said that.
Okay, thanks.
Thank you for that. And we have another question. It says, are there any other tips for academics? What was your study routine in school? And I think it'll be better if you start with high school too, because we have high school students here too.
Yeah, definitely. In high school, I definitely didn't have a structured, what is the word I'm looking for? A structured approach to how I studied. I think I more so was kind of going day by day by what tasks I had. I think looking back on it, it would have been great had I planned ahead the different things I needed to get done and allotted times for it. I started time blocking, I think, a little late in high school, which is basically, I used to have a planner and it was broken down by hour, and I used to block off the hours with school, with extracurriculars, with classwork, and so on and so forth. a big thing for me was that I tried to maximize Friday afternoons. So there's always these like couple of hours between class ending and like the football game that Friday night, or like whatever I was doing with my friends and so forth. It'd be like 3-ish hours. And I used to purely dedicate that to studying. I used to like make the most out of that like 3 hours on a Friday afternoon. And like, then I would enjoy the rest of my Friday night. And I would try to do as much as I could Saturday mornings before noon. So I'd have the entire rest of my Saturday, rest of my Sunday, and then I could go on with the rest of my week. The week was definitely more challenging, but as long as I tried to do that, I felt like I didn't get too far behind. In college, it got a lot more intense. I definitely had a lot more hours that I was studying. I think I definitely slept a lot less, but I was younger then, and I feel like I could handle it, so it was fine. But definitely the same approach where I would do time blocking. So I had my classes, I had the work that I needed to get done, and all the social stuff that I knew that I wanted to participate in. And so really maximizing like that time between classes throughout the day, so that at night I had time to do whatever I wanted. Or if I knew I was busy during the week, like really spending a whole day studying on Saturday, a whole day on Sunday. So undergrad was definitely a lot more intense. But I think that also set me up really well for when I did get to pharmacy school, because it helped me to really refine the way that I approached needing to get things done and like how I know I operate. And so for me, sometimes I need a good amount of pressure in order to like really get started on something. And so planning those things a little bit closer to deadlines versus the things I knew were going to take more time, it really opened up my schedule, because I knew myself well enough to know really when I needed to start something versus when I didn't, when I needed to allot time here or there. And I think as you go throughout schooling, definitely give yourself the opportunity to try different things and be okay with the fact that you might fail in that certain regard, because you can always bounce back. You can always try something new and different. And then hopefully by the time you get to, whether it be your postgraduate training or professional, or just like your whole life in general, you start to be able to get this balance and hopefully enjoy time both professionally and socially.
All right, thank you for that too. Any other questions? Actually, I have a question that's like a follow-up question about like what you just said. So were there any like, I know you said about like your iPad and note-taking apps. Was there any like other apps that you use? Like I know Unki is like a really huge flashcard app that like medical school students use that. So did you ever like use like stuff like that?
Yeah, so I use Quizlet every now and then when I needed it in pharmacy school and for studying for board exams. There's some great brand generic decks out there. Other things that I use, so I did use OneNote to do my note taking, which I thought was really helpful. I like it better than some of the other note-taking apps, because when you import a lecture, it doesn't create a set space around the lecture slide itself. You can actually write freehand, basically as far and as wide as you want to. Other apps that I found really helpful that I use now, I use the Microsoft To-Do app to keep myself organized. So I create a group for every week, and then I create a day of the week for each list, and then I'm able to easily move around my responsibilities and things like that. I have a lot of different deadlines and like things I need to get to, but in the midst of patient care, I can't really get to them in the moment. So I leave myself a quick little note to make sure I check back in on that and that it gets done later. As far as Anki goes, definitely more of like a med school thing, I think. I know some pharmacy students use it. I did check it out at the beginning of my first year of pharmacy school, and it just wasn't something that I felt like really like worked for my learning style, but that's not to say that it can't work for others. And I'm trying to think of other apps per se. I feel like OneNote was just the biggest one that I used all the time. I don't think I have any. Yeah, I'm not sure I have much else as far as pharmacy school goes. I have a couple of other like professional ones for different types of things and whatnot. But as far as studying goes and having resources, I think that was the big one. We also use Lexicomp, which is a drug information resource. And so we had access to that as students, and I thought that was really helpful.
Is that like university related stuff?
Yeah, you can have a subscription to it, though it is quite expensive, but the university I was at and the one I'm at now did offer subscriptions to it. And so I was able to use that. But I know there are others like Micromedics that can be really helpful just to better understand drugs. I think those are the two big ones.
Okay.
Yeah.
So I have just like general questions that you can like I want to ask you or like
Yeah.
really. Okay, so I know you already like said a lot of recommendations about stuff like that, but any other advice to specifically high school students that you hear?
Yeah, when you're in high school, for myself personally, one of the biggest things was that I didn't feel like I could go into undergrad without a plan of what I was doing and why I was doing all the things I was doing. So really take this opportunity while you're in this unique spot of discovering things, and you can use the excuse that I'm in high school, I want to know more, to really go out and explore what you want to do, whether it's in pre-health or not, whether it's something else. Use this opportunity to go on LinkedIn, figure out what companies or what different institutions are near you, people who are in the job positions or have the titles that you may be interested in, and just message them. Be really polite, be straightforward, and see if they'd be willing to take the time to speak with you or to have you shadow, to figure out more about what their job is, their path to getting there, and what a day in their life looks like. I use the excuse that I was a student and a learner all the way up until 2 years ago. So use where you are at and the fact that you have the whole world in front of you and all of these options as the confidence to go out there and explore them, because so many people are willing to share their experience and want to share how they got to where they are. And I would have loved to have had the opportunity to probably see someone in the same spot they're in. So the worst that can happen is that they say no or they ghost you. And in that case, you're exactly where you started. So really nothing lost. And create a template, figure out a wording that works for you. Introduce yourself, explain that you'd like to learn more, use a small piece of information, personal information, and go from there. And so really just make it easier on yourself, but don't stop exploring and give yourself a shot at doing anything really.
All right, so the same type of question for undergrad and grad students.
Yeah. So in undergrad, I think that my biggest piece of information is to get involved, really figure out, could you see yourself doing this? Surround yourself with people who are slated to take that next step into the next stage. For me, when I was my freshman year of undergrad, it was really helpful being in the pre-pharmacy club because I was surrounded by sophomores, juniors, seniors who were all had already had the experiences I had, were already in the classes that I had taken, who were moving forward to where I saw myself going, and they could give me tips, tricks, opportunities, so on and so forth. So really get involved, meet like-minded people, create a network. Don't be afraid to put yourself out there. Join many different clubs, join one club, do whatever you feel you're comfortable with. The greatest part about undergrad is that nobody knows who you are. You can totally start over, be anybody you want to be, the person you've always wanted to be, change it up, do whatever you want, and figure out what works for you, because going into graduate school, it's definitely a commitment. You're in this spot now, and hopefully it's something that you like to do, and you'll hopefully really like it if you gave yourself those opportunities to explore in undergrad. So in graduate school, really, that's when I think creating a network starts to become of the utmost importance. Not only are you looking for potential job opportunities, you're really seeking out mentors who may know the space and the arena that you're going into, and you really want to become well-versed in the various different aspects and paths you can take within your profession, because whether you go one direction or another, your experience in any of the different types of areas will be able to give you a better insight into what all you can do with your degree, and as far as what other avenues you might be able to take later down the line.
All right, that was super helpful for me because I'm a rising senior in high school right now, so I'm going to college.
Yeah.
So that was actually really helpful to like start over. It was really assuring, actually.
Yeah, oh my God. And it's never too late. I don't care what stage of life or anything, even right now for myself, if I decided I wanted to do something different, it's never too late. However many years you think it's going to take you to do XYZ thing, you're going to be that age in that many years anyway. So you might as well be doing the thing that you want to do. So never be afraid to start over. Never be afraid to question everything you're doing. Reflect, take the time to think inwardly, like really look at what you're doing. And if it's not serving you, if you feel like you're not able to be the best version of yourself or really give your all to something, then reorient, figure out where you need to be, talk to people, like lean on those people in your life that you can count on, and don't be afraid to question it.
Actually, did you ever like regret something that you did not do in high school or in college?
Man, that's a great question. I unfortunately have an inability to say no. So I feel like I said yes to most things I wanted to do, which led to probably some later studying than I should have been doing. But no, I don't think there's really anything I look back on. I think there are things I sacrificed because I was willing to do that. And it really wasn't something I was interested in, or I felt like I needed to do it in lieu of being able to pursue this because I knew I really cared about this. And I think also a huge thing, and maybe it's just like my family and the way I grew up and whatnot, but there was really this emphasis on like continuing to live your life amidst all of this. Like, no matter what career you go down the line with and so on and so forth, it'll all every now and then feel all consuming. Like your professional life is like the most important thing. But if there's ever a time when your friends are in town and you could either go to dinner with them or study, go to dinner with them. Like if there's ever an opportunity where this club is doing this outreach event and like it's like 2 or 3 hours, like go to that and study afterwards. Like make choices that you know you can sustain. Always choosing to study is never going to get you to where you want to be. It's very easy to burn out and foregoing everything else in your life just to keep moving forward. Had I done that, I would be going on 8 years of doing nothing for myself. And for that for me is just not acceptable and exactly what I wanted to avoid. And so to be able to find a way to balance your personal life with your professional life should be something you prioritize. And sometimes that means making a decision where you prioritize the personal, and that feels like it's going against every single fiber of your being. But 9 times out of 10, I've come back from a social situation and been even more rejuvenated and like more so ready to study and really like hit the ground running, because I know that I'm able to do both of these things. And it really energized me and pushed me forward to see that I can have everything. It's possible to have everything. Just sometimes you have to make sacrifices for one or the other. But in the general picture, you can have it all.
All right, thank you so much. I'm gonna actually share my screen because I have some end of the presentation information. So. All right. There you go. And again, this recording will be posted on our YouTube channel. So just like go if you did miss something. And this is just for the questions. Any last minute questions that you guys have?
Could we email you with future questions?
Of course, absolutely. Never think twice about it. You absolutely can.
Thank you.
She's very helpful.
And thanks for all your questions, everyone. I really appreciate it.
All right. So here's some outreach social media. So we have our Instagram, that is Medical Wonders. And then we also have our TikTok. And again, you can join our Google Classroom for the hours and the certificate if you did attend 2 or more and you did submit your documents about like the 5 to 6 lines or your sentences actually. And that is about all. So here is again our social media if you want to follow, because we send out a lot of updates. All right. So you can leave now. You can, or actually, Dr. Ver, if you can put your email in the chat. Okay, so if you have any other questions, it's really helpful. Thank you for joining us here and for your presentation. We really appreciate your help and your time over here.
Yeah, of course. Thank you for having me and good luck with everything, you all.
All right.
Thank you. Bye.
Thank you. Bye.